Extraction of a tooth is performed. The patient is a 56-year-old Japanese female. The maxillary left molar is extracted due to periodontitis. An extraction socket is usually treated with absorbent cotton sponge for hemostasis. We now have a new product available for extraction socket protection, which not only provides hemostasis, but also promotes regeneration. When Teruplug is filled into the extraction socket, it protects the wound surface and promotes granulation by hemostasis. Teruplug should be filled tightly to prevent any void. The extraction site should be closed with suture in order to avoid displacement of Teruplug. Teruplug is known to promote bone in severe bone distraction cases associated with severe periodontitis. It also demonstrates significantly a reduction of risk of delayed healing. For example, following extraction in a patient with underlying hepatic disease, or those on dialysis. Wound healing following extraction is observed in a beagle dog. The mandibular left teeth are extracted. Teruplug is filled in the extraction sockets. This is a soft radiograph of 1 week post-operation. Soft radiograph after 1 month shows optimal soft tissue healing. Bone density in the affected site is increased in 3 months. Let's look at a tissue sample. The extraction socket filled with Teruplug can be seen in between the alveolar bone and soft tissue. The tissue sample of 1 week post-extraction shows the fibers of Teruplug. 1 month later, numerous cells infiltrated into Teruplug at the center of the tissue sample, which is expected to form new bone. 3 months later, Teruplug is mostly replaced with new bone. The alveolar bone around the extraction site is well maintained. What is the inner structure of Teruplug? Let's check a section of Teruplug under a scanning electron microscope. Teruplug is made of atelocollagen from bovine dermal collagen. Teruplug appears as a sponge-like structure made of atelocollagen. Teruplug is made of fibrillar and heat-denatured atelocollagens. It is processed to a bullet shape. Teruplug absorbs blood and water in the extraction socket and becomes softer. What occurs in the socket? To answer the question, a thin section of Teruplug is cultured with a bone fragment of mouse calvary. bone fibroblasts and osteoblasts, infiltrates the hydrate Teruplug fibers. Teruplug does not cause any foreign body reaction. Infiltrated cells in Teruplug shows division growth simultaneously. Teruplug becomes a matrix for these cells to spread gradually. Teruplug fibers are absorbed and are eventually being replaced by regenerated tissue. The cells attached to Teruplug fibers form new tissue. At 1 week culture, Teruplug is completely covered by cells and can no longer be its original shape. After 3 weeks of culture, a red stain, specific for alkaline phosphatase, is used in order to provide a marker of bone formation. Let's check out the change in Teruplug under the scanning electron microscope. The structure of Teruplug changes after 2 weeks culture. This magnifying view demonstrates that Teruplug is covered with various cells from bone. Residual Teruplug fibers remain among the mass of cells. An area osteoblast layering, which indicates new bone formation. Following cell invasion, vascularization occurs and tissue is regenerated. Finally, the extraction site is healed. The effectiveness and safety of Teruplug were examined. The results showed that Teruplug was effective, or better, in 105 of 114 cases examined in 7 institutions, with an effectiveness rate of 93%. No side effect or related complication was reported. This is an extraction from a 73-year-old diabetic patient. The site is healed 4 weeks after Teruplug was inserted. Teruplug is very effective to promote regeneration of the extraction socket, and Teruplug is biocompatible.